There is a category of disease that doesn't shout at you. It doesn't arrive with chest pain or sudden bleeding or a fever that puts you in bed for a week. It moves quietly in the background while you're getting on with your life. And by the time it's loud enough to demand attention, the damage it has caused is often the kind that doesn't fully reverse. Low vitamin B12 is one of those conditions. It's silent in the most literal sense. The symptoms it produces in the early stages are easy to ignore, easy to attribute to something else, and almost designed to be dismissed. A bit of tingling, a bit of tiredness, a bit of forgetfulness. Each one on its own sounds like life. Together, they're the body's quiet alarm system going off, and most people never connect them. The reason this matters so much is that B12 is responsible for two jobs the body absolutely cannot do without: building red blood cells properly and maintaining the protective insulation around every nerve in the body. When B12 runs low, both of those jobs start to fail, slowly, silently, without making a scene. And the longer the deficiency goes uncorrected, the more permanent the consequences become. And we're talking about damage to the spinal cord, damage to the peripheral nerves, damage to the brain itself. There are 8 silent symptoms that, in my experience working in emergency medicine, get ignored more often than almost any other warning the body sends. Recognizing them early is the entire difference between a problem that resolves and a problem that becomes part of someone's life forever. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years in the AANDE, I've seen what happens when preventable disease isn't prevented. I've admitted patients in their 50s and 60s whose silent symptoms had been progressing quietly for years, dismissed by themselves and sometimes by their doctors, until they finally arrived in the emergency department with neurological problems severe enough to demand admission. In some of those cases, we caught it just in time. In others, we didn't. And the difference between those outcomes almost always traced back to whether someone had taken the early signals seriously. So before we go any further, I want to make you a promise. I promise to keep creating the most helpful videos I possibly can, grounded in science and the latest research, to help you live longer and to help you prevent the diseases I see in the emergency department every single day. And all I ask in return is that you give this fairly new channel a chance and hit the subscribe button. If you get to the end of this video and you didn't think it was worth your time, or you've not learned something new, then feel free to unsubscribe. No hard feelings. But if you give me your time and your attention, I'll give you everything I've learned from over a decade in medicine. So please help me out. Hit the subscribe button to help this channel reach more people like you. And let's continue with the video. Before we get to the 8 silent symptoms, I want to spend a few minutes explaining what B12 actually does inside the body, because the symptoms only make sense once you understand the mechanism. B12 is what we call a cofactor, which essentially means it's a helper molecule that 2 specific enzymes in your body cannot function without. Those 2 enzymes carry out tasks so fundamental that when B12 runs low, multiple systems begin failing at the same time. That's the part most people miss. B12 deficiency isn't a single symptom. It's a constellation of failures because one master ingredient has dropped below what the body needs to operate. The first major job B12 does is help your bone marrow build red blood cells. Every single day, your body produces around 200 billion new red blood cells to replace the ones that have worn out. Each one of those cells needs to divide cleanly, which means its DNA has to copy itself accurately. B12, working in tandem with another vitamin called folate, is essential for that DNA synthesis step. Without enough B12, the cells can't divide properly. Instead, they grow too large, too few, and they don't carry oxygen efficiently. We call this megaloblastic anemia. The cells are still being produced, they're just oversized and underperforming. So your tissues, your brain, your muscles, your heart all start operating on a reduced oxygen supply, and that's where a significant number of the silent symptoms originate. The second job B12 does is even more critical, and it's the one that causes the most lasting damage when ignored. B12 is essential for maintaining what we call the myelin sheath. Myelin is the fatty insulation that wraps around your nerve fibers, almost exactly the way plastic insulation wraps around the copper wire in your house. Without that insulation, electrical signals can't travel cleanly. They leak, they short circuit, they slow down. When B12 runs low, your body can't maintain the myelin properly, and over months and years, the insulation starts breaking down. The nerves underneath become exposed, they misfire, and eventually, if the deficiency goes on long enough, they begin to die. This is why B12 deficiency causes numbness, tingling, balance problems, and in severe cases, a condition called subacute combined degeneration of the spinal cord, which is exactly as serious as the name suggests. Now here's where it gets really interesting, and where most people get tripped up. Your body absorbs B12 through a remarkably complicated process that depends on several things working in sequence. First, you eat the B12, which is bound to animal protein in your food. Second, the acid in your stomach has to release the B12 from that protein. Third, a molecule called intrinsic factor, which is made by specialized cells in the stomach lining, has to bind to the B12 and escort it down to a very specific section of your small intestine called the terminal ileum. Fourth, the cells there have to recognize the intrinsic factor and B12 complex and pull it across into your bloodstream. If any one of those 4 steps fails, absorption breaks down, and in modern adults, there are dozens of reasons those steps fail. Stomach acid drops naturally with age. By the time many people are in their 60s and 70s, they're producing significantly less acid than they did at 30. That alone reduces B12 release from food. Add in the widespread use of acid-suppressing medications, the proton pump inhibitors, and the H2 blockers that millions of people take daily for reflux, and you have an entire population whose stomachs simply can't extract B12 from animal protein anymore. Then there's metformin, the most commonly prescribed diabetes medication in the world, which interferes with B12 absorption in the terminal ileum. Layer in conditions like celiac disease, Crohn's disease, gastric bypass surgery, and a condition called atrophic gastritis, where the stomach lining wears thin. And you start to see why B12 deficiency is so common in adults over 50, even when their diet contains plenty of B12 on paper. And there's one more piece of this puzzle that almost nobody talks about. The standard B12 blood test, called serum B12, measures total B12 floating in your bloodstream. The problem is that only about 20% of that B12 is actually active and available to your cells. The other 80% is bound to inactive carrier proteins and isn't doing anything useful. So you can have a normal serum B12 level on paper while your cells are functionally starved. The more sensitive tests are called active B12, which measures only the usable form, and methylmalonic acid, or MMA, which rises when B12 is functionally low at the cellular level. Most GPs don't run those tests routinely, so the deficiency gets missed in countless people who've been told their levels are fine. What we're now understanding is that B12 status exists on a spectrum, not as a simple yes or no. There's a grey zone, often called borderline or low normal, where the standard test looks acceptable, but the patient is symptomatic, and the more sensitive tests reveal real deficiency at the cellular level. That grey zone is exactly where the silent symptoms live. Long before the standard test catches up, the body has already been signalling. The question is whether anyone is listening, and whether the signals are being interpreted correctly when they appear, or whether they're being filed away as just part of life. Just really quickly, if you're getting value from this video so far, please consider subscribing. It genuinely helps the channel reach more people who need this information. So let's get to the 8 silent symptoms that most people ignore until the damage is done. The first symptom is intermittent tingling or numbness in the hands and feet, often described as pins and needles that come and go without warning. This is one of the very first signs of myelin breakdown in the peripheral nerves. People dismiss it as having slept on their arm, or as a circulation problem, or as something to do with their shoes. But when it happens regularly, when it wakes you up at night, when it lingers for hours, that's the nervous system telling you the insulation on your wires is wearing thin. It's silent because it doesn't hurt. It just hums in the background. And by the time it gets loud enough to alarm someone, the nerve damage is often already significant. The second symptom is a strange, unsteady feeling when you walk, particularly in dim light or with your eyes closed. The medical term for this is proprioceptive loss, which is your brain's awareness of where your limbs are in space. The nerves that carry that information run through the back of your spinal cord, and they're some of the first nerves to be damaged when B12 falls. Patients often tell me they feel like they're walking on cotton wool, or that they have to look at their feet to know where they're stepping. That's not just clumsiness. It's a silent neurological signal, and in older adults, it dramatically increases the risk of falls long before anyone connects it to a vitamin level. The third symptom is a sore, smooth, or burning tongue. The medical name for this is glossitis. The cells lining your mouth and tongue divide rapidly, just like your bone marrow cells, so they need B12 to replicate properly. When B12 not, those cells can't keep up, and the tongue can lose its normal texture and become inflamed, painful, or unusually red and shiny. People often blame it on toothpaste or on something they ate, but if your tongue feels burnt or sore for days at a time without an obvious cause, B12 belongs on the list of things to check. The fourth symptom is unexplained fatigue that doesn't improve with rest. This is the one that gets dismissed more than any other because everyone is tired and everyone has a reason to be. But B12 deficiency fatigue has a specific quality to it. It's a deep oxygen-starved tiredness that comes from your red blood cells failing to deliver oxygen properly. People describe feeling winded, climbing stairs they used to take easily, or needing to sit down halfway through tasks they used to do without thinking about it. If your fatigue is consistently worse than your life justifies, that's worth a closer look. The fifth symptom is mood changes that look like depression but don't respond to standard treatment. B12 plays a direct role in producing neurotransmitters like serotonin and dopamine, the chemicals your brain uses to regulate mood. When B12 runs low, mood regulation suffers. I've seen patients put on antidepressant after antidepressant for years with no real improvement, only to find their B12 was significantly low the entire time. Within weeks of correcting it, the fog lifts. That doesn't mean every case of low mood is B12, but it absolutely belongs in the workup before someone is told it's just depression. The sixth symptom is memory problems and brain fog, particularly in adults over 50. This is the one that frightens people the most because it can look like the early stages of dementia. And here's the cruel irony. B12 deficiency can cause a reversible cognitive decline that, if caught in time, responds beautifully to treatment. But if it's left to progress for years, the damage to the brain becomes permanent. I've had patients come through the emergency department who were already being assessed for early Alzheimer's, and the answer turned out to be a vitamin level. That's how big this gap is, and that's how important it is to test properly before assuming the worst. The seventh symptom is pale or yellow tinged skin. The pallor comes from anemia. The yellow tinge, which doctors call jaundice, comes from the oversized red blood cells that B12 deficiency produces breaking down faster than they should. The byproducts of that breakdown accumulate in the blood and tint the skin and the whites of the eyes. People often think they look tired or hungover. They don't realize they're looking at the visible signature of a B12 problem playing out in their bone marrow, often weeks or months before the deficiency is formally diagnosed. And the eighth symptom is heart palpitations, breathlessness on mild exertion, or a fast resting heart rate. When your red blood cells aren't delivering oxygen efficiently, your heart compensates by working harder. It beats faster, it pushes more volume per minute. Patients feel their heart racing for no obvious reason, or they get short of breath walking to the kitchen, and they assume it's anxiety or it's their age. In many cases, it's the cardiovascular consequence of an oxygen delivery problem that started in the bone marrow because B12 ran out. The heart is doing the extra work because the blood isn't pulling its weight. Now, when you see those 8 silent symptoms listed together, you might recognize 3 or 4 of them in yourself or in someone you love. And that recognition is exactly the point. Because individually, each one gets dismissed as something else. Together, they tell a coherent story. And it's a story that the right test can confirm in a matter of days, often well before any permanent damage takes hold. So what do you actually do about it? I'm not advocating for extreme approaches here. I'm not telling you to start injecting yourself with vitamins or to abandon your current medical care. What I'm going to walk you through are 5 concrete actions that, taken together, address the absorption pathway, restore the cellular supply, and protect your nervous system from progressing into the kind of damage that doesn't fully reverse. Each of these ties directly back to the mechanism we talked about earlier. The first action is to ask your doctor for the right test. The standard serum B12 test is the absolute minimum, and as I explained, it misses a remarkable proportion of functional deficiencies. What you want to ask for is an active B12 test, sometimes called holotranscobalamin, and a methylmalonic acid test. Together, those two tell you whether the B12 in your blood is actually getting into your cells and being used properly. If your GP isn't familiar with those tests or pushes back, you can request them privately through most major laboratories for a relatively modest cost. This is the single highest leverage action on this list, because without the right test, everything else is essentially guesswork. You're treating a problem you haven't actually confirmed. The second action is to address the absorption pathway. If you're over 50, if you take acid-suppressing medication, if you take metformin, if you've had any kind of stomach or bowel surgery, or if you're following a plant-based diet, your absorption is almost certainly compromised. For most people, oral B12 supplementation in the form of methylcobalamin or hydroxycobalamin is the practical first step. The doses needed are typically higher than what's in a standard multivitamin, often in the range of 1,000 micrograms daily because absorption is so inefficient at the gut level. Think of it like watering a garden through a leaky hose. You have to put more water in at the top to get enough out at the bottom. For people with confirmed deficiency or absorption disorders, B12 injections given by a clinician bypass the gut entirely and restore levels reliably. I'm not suggesting anyone stop taking their prescribed medication without talking to their doctor. Medication and lifestyle are not mutually exclusive. They work better together. The third action is to look honestly at your diet. B12 is found almost exclusively in animal products, meat, fish, eggs, and dairy. Plant foods don't contain meaningful amounts unless they've been deliberately fortified, like some breakfast cereals and plant milks. If you're eating a vegetarian or vegan diet, supplementation isn't optional. It's essential, and even for people eating plenty of animal protein, the absorption problem we talked about means that diet alone often isn't enough past a certain age. Research published in the American Journal of Clinical Nutrition has shown that adults over 60 often have markedly reduced B12 status even when their dietary intake looks more than adequate. The food is going in, it's just not getting absorbed at the rate it used to. The fourth action is to support the broader B vitamin family because B12 doesn't operate in isolation. Folate, which is vitamin B9, works hand in hand with B12 in the DNA synthesis pathway. If folate is high, but B12 is low, it can actually mask the anemia on a standard blood test while the neurological damage continues silently underneath. This is why supplementing folate without first checking B12 status can be genuinely dangerous in older adults. The two need to be assessed and corrected together. Eating leafy greens, legumes, and whole foods covers most people's folate needs naturally. But if you're supplementing, do it knowingly and ideally under guidance from someone who understands the interaction. The fifth action is to protect your nerve health more broadly while you correct the deficiency. Regular movement increases blood flow to peripheral nerves and supports their repair. Adequate sleep is when the nervous system does most of its maintenance and consolidation work. Managing your blood sugar matters here too, because high glucose levels independently damage peripheral nerves through a separate mechanism. And if you stack B12 deficiency on top of poorly controlled blood sugar, the nerve damage accelerates dramatically. Whole foods, regular activity, and proper sleep aren't glamorous interventions, but they're the soil in which B12 correction actually works. Without that foundation, you're trying to repair wires while the rest of the electrical system is still being damaged in the background. Let me bring this back to the central point. Whey12 deficiency is a multi-step problem, which means the solution is also a multi-step process. You can't just take a tablet and assume it's been handled. You have to confirm the deficiency with the right test, address the absorption pathway, fix the dietary supply, support the cofactors that work alongside B12, and protect the broader nervous system while repair takes place. When all five of those happen together, the recovery in many cases is extraordinary. Numbness fades, energy returns, mood stabilizes, cognitive sharpness comes back. I've watched patients in my clinic go from being convinced they were developing dementia to being completely back to themselves within 3 to 6 months of proper treatment. That's not a small result. That's a life trajectory being rewritten. I want to share a few things I've seen on the front line because the numbers and the mechanisms only mean so much without the human side. I had a patient in her late 60s brought in by her daughter because she'd become unsteady on her feet and was getting confused in the evenings. The family was bracing themselves for an Alzheimer's diagnosis. We ran a broader workup than usual. Her active B12 was severely low. Within 8 weeks of starting injections, her gait improved. Within 4 months, the evening confusion was gone. Her daughter cried in the corridor when we told her the test result. Not every case ends like that. Some patients arrive too late, and the spinal cord damage doesn't fully reverse, but many cases, if caught in time, do. I had a man in his 50s who'd been on metformin for nearly a decade for type 2 diabetes. He came in with palpitations and breathlessness. His ECG was unremarkable. His full blood count showed enlarged red cells. His B12 was at the very bottom of the reference range, technically normal, but his MMA was significantly elevated. He'd been functionally deficient for years, missed by every routine check, while the medication that was helping his diabetes was quietly depleting the vitamin that his nerves and his blood depended on. After supplementation, the palpitations resolved and his energy returned to a level he hadn't felt in years. What these cases have in common is that they represent the gap between what the standard tests catch and what's actually happening at the cellular level. Research in the journal Blood has shown that as many as 1 in 6 older adults may have functional B12 deficiency that the routine serum test fails to identify. That's a remarkable number. It means in any given waiting room of patients over 60, several people are walking around with a slow biochemical drag on their nervous system that nobody is treating and that nobody is even properly tested for. And here's the bigger picture I want you to take away. The reason this matters isn't just about avoiding tingling fingers or fixing a low mood. It's about what it means to live well into your 70s and 80s with your independence intact. The single biggest determinant of independence in later life is whether your nervous system still works, whether you can walk steadily without falling, whether your brain can still hold the thread of a conversation, whether you can drive, cook, manage your own medications, recognize your grandchildren. All of that depends on nerves and brain cells that need a steady supply of the building blocks they were designed to run on. B12 is one of the most important of those building blocks. Letting it run down for years isn't a small thing. It's the difference between aging into your 80s with your faculties intact and aging into your 80s dependent on others for basic tasks. This isn't your fault. The system has been failing to test for it properly for decades. The medications that contribute to it are widely prescribed without warning patients about the connection. The food system has shifted in ways that make absorption harder for older adults. None of that is on you, but the knowledge of what to ask for, what to look for, and what to do about it is now yours. And once you have it, you can act on it. You can pass it to your parents. You can pass it to your partner. You can pass it to anyone in your life who's been told their fatigue or their numbness or their brain fog is just part of getting older. 8 silent symptoms: pins and needles in the hands or feet, an unsteady walk, especially in the dark, a sore or burning tongue, deep fatigue that rest doesn't fix, mood changes that won't lift, memory problems and brain fog, pale or yellow-tinged skin, a racing heart or breathlessness. If you recognize 3 or more of those in yourself or in someone you love, ask for the right test. Active B12 and methylmalonic acid. Don't accept normal serum B12 as the final answer if the symptoms are there. The damage is preventable. The treatment is straightforward, but only if it's caught while the symptoms are still silent, before they become the kind of damage that can't be undone. If you found this useful, please subscribe to the channel to help me reach more people.